One of the most undiagnosed conditions that I see each day in my office, especially in children, is sleep disordered breathing. How do you know if this could be affecting you or your child? These are the most common symptoms that I see. Breathing through your mouth 30% of the day is considered severe. Snoring, grinding your teeth at night, chronic fatigue, even when you are sleeping enough hours, heightened stress, behavioral issues in children, chronic congestion, struggling with chronic asthma and allergies, and even fighting constant head colds. Not only does this affect your quality of life day to day, but it also puts you and your child at risk of other oral and systemic health problems down the road, such as cavities, gum disease, heart disease, and stroke. You should be breathing through your nose day and night, except when eating or speaking. The tongue is the on-off switch for nasal breathing. So when the tongue is up, it signals to your body to breathe through the nose. But when the tongue sits on the floor of the mouth or in the middle of the mouth, your body resorts to breathing through the mouth. The goal of airway medicine is to improve tongue tone, tongue mobility, tongue space, and address airway obstructions so you can sleep and breathe better. And the earlier we begin the process, the better. Airway medicine is fortunately becoming more common as both providers and patients are increasingly seeking out holistic solutions to their health concerns. Tongue space refers to how much space there is for the tongue to comfortably rest on the roof of the mouth between the teeth. Tongue mobility refers to the ability of the tongue to reach the roof of the mouth without compensation, such as the floor of the mouth coming up with the tongue. And tongue tone refers to how strong the tongue is and if it can rest on the roof of the mouth both day and night. Airway obstruction refers to anything preventing you from breathing properly, such as a deviated septum, enlarged tonsils, or chronic congestion. Another factor that greatly affects airway health are tongue and/or lip ties. Tongue and lip ties prevent the tongue from resting in the proper place for healthy nasal breathing. However, not all ties require releases. Tongue and lip tie releases, also called functional frenuloplasties, are recommended when the tongue or lips are causing issues such as inadequate speech or jaw development and poor eating habits. These procedures are completed by using a laser to make a small incision that detaches the restricted tongue or lip. After release, a series of stretches and exercises monitored closely by a team of trusted providers ensures the success of the procedure. At Restoration Dentistry, we screen for signs of these airway issues and work with a collaborative team to support you in achieving proper nasal breathing and in turn sleep better, feel better, and live better. We take a functional or interdisciplinary approach to airway health, which means we include orthodontists, ENTs, craniosacral therapists, lactation consultants, allergists, and chiropractors in your care team so that we ensure you get the best results. We look forward to supporting you in your journey to achieve oral and overall health.